Did you know that gout is a type of inflammatory arthritis? It affects 5% of men and 2% of women. The most common symptom is podagra, a very painful inflammation of the big toe. Today, I will explain what is the link between uric acid and gout. Can changing diet reduce gout attacks? Is there any medication to treat gout? Are these tophi nodules related to gout? And are exercises good for gout arthritis? So, let's talk about gout today. Before I continue, please remember that these videos are for educational purposes only. You should consult a physician to make the diagnosis and tell you which treatment is indicated for you. If there is an emergency, go to the nearest emergency department or call an ambulance. A gout attack is a sudden accumulation of needle-like crystals in areas of the body like the joints and the kidneys. These needle-like crystals are formed because there is too much uric acid in the blood. Why is there too much uric acid in the blood? Well, it can be because there is too much formation of uric acid, or the elimination of uric acid by the kidney is impaired. Not everyone who has high levels of uric acid in their blood will develop gout. Gout is more common in individuals older than 65 years, and their immune system will attack those crystals and cause inflammation. Uric acid comes from the breakdown of some high-protein food. That's why we can lower the levels of uric acid by avoiding certain foods. I'll give a list later in this video. These crystals can also deposit under the skin, forming these bumps that we call tophi. They can also accumulate in the kidneys, causing kidney stones. Any joint of the body can be inflamed by a gout attack, but the most common ones are the feet, ankle, and knees. These attacks usually last around 1 to 2 weeks. They start very suddenly with excruciating pain and disappear very suddenly too. However, if they last longer than 2 weeks, we need to investigate and reduce the uric acid levels in the blood. Otherwise, they will have more and more attacks. And each time, this inflammation may cause permanent damage to the joint. So how do we know if a joint pain, like an inflamed arthritis like this, is gout or not? The joint will be very red, swollen, hot, and painful. If necessary, we may do a joint aspiration with a needle. Then we send the fluid to the laboratory and we see these crystals inside of the joint. These crystals have been accumulating slowly inside of the joint. They don't get there suddenly, but what happens is that there is a trigger that makes the production of uric acid spike, and then this is what triggers the inflammation. These triggers can be a protein-rich meal, a period of dehydration, or drinking alcohol, especially beer. We may need to order an X-ray to see the extent of damage to the joint, and also monitor the levels of uric acid in the blood to check if they're going down with treatment. So, how do we treat gout? With proper treatment, very few patients will develop advanced stages of gout like this. Most people who receive proper treatment early after the diagnosis will not even notice any joint deformity. So what's the treatment for an acute attack? The person can take an NSAID, or a non-steroidal anti-inflammatory drug. I have another video about NSAIDs. These medications will reduce the inflammation response of your body to the crystals. The NSAIDs will not eliminate the crystals from the joint. Well, talk to your doctor or your pharmacist about the best NSAIDs for you. There are various types and different doses, but here are just some examples: ibuprofen, naproxen, diclofenac, and indomethacin. For people who cannot take an NSAID, there is colchicine, a medication that has been used for more than 2,000 years, which reduces the inflammation. Corticosteroids can also be used to reduce inflammation, either by injection or by oral pills. During a gout attack, the person may also apply ice. I have another video about ice and hot and cold. Always protect the skin to avoid ice burns. Leave the ice pack for about 20 minutes each time and use it 3 times a day. Do not apply heat to reduce pain from a gout attack. Now I'm going to talk about how to reduce uric acid levels. This is important to stop the gout attack, but even more important, to prevent future attacks. Because uric acid is produced from certain foods, it's important to avoid them. And here they are: processed meat, red meat, organs meat like liver and tongue, shellfish such as shrimp, lobster, and mussels, oily fish like herring, sardines, and mackerel, sugary beverages including pops and juices, any food that contains corn syrup, alcohol, especially beer. Did you know that in the past, gout was known as the king's disease? It was more common in people who had high protein diets, beers, and some rare fish. So only the rich people could afford these meals, and gout was more common among them. There is another inflammatory arthritis, very similar to gout. It's called pseudogout. It is caused by crystal deposits in the joint, but they are not urate crystals. So the treatment of pseudogout does not involve the same dietary restrictions, because that's not caused by uric acid crystals. The main method to diagnose if the arthritis is caused by gout or pseudogout is to aspirate the fluid from the joint and look at what kind of crystals are present in the fluid. People who are obese and overweight, they tend to have more gout attacks. So it is important to maintain a healthy weight or a body mass index, BMI, between 18.5 and 24.9. Another important aspect is to remember to keep hydrated to avoid gout attacks. Well, if diet and lifestyle modifications are not enough to prevent gout attacks, there are medications that can reduce uric acid levels. Once the person starts taking these medications, they need to stay on them for the rest of their lives. These medications include Allopurinol and Probenecid. In people with chronic gout, there is permanent joint destruction and deposits of crystals in the skin. These are called tophi. And last, in people with gout, there is an accelerated joint destruction, and this leads to deformities and pain. This is what we call osteoarthritis. So exercises are always the first choice treatment for osteoarthritis. You need to remember the LAWS exercise, LAWS, that I demonstrated in the video of hip and knee osteoarthritis. L is for lubrication exercises. Remember, motion is lotion. They help to warm up the joints, improve range of motion, and break down any thick fluid. You may do lubrication exercises in the morning before you get up from bed. A is for aerobics. They are important to maintain a good cardiovascular system. They also help to maintain a healthy weight. They include walking, biking, dancing, swimming. Make sure to talk to your doctor and ask if you don't have any restrictions to do cardio exercises. W is for weight-bearing exercises. The main advantages are that they reduce pain and maintain calcium in the bones. This is important to avoid osteoporosis, another condition that is very common in people with osteoarthritis. S is for stretching. This is important to maintain flexibility of the joints, to improve range of motion, and to reduce muscle tension. I have other videos that I demonstrate exercises for osteoarthritis and the loss exercises. In summary, gout is a disease that affects many older individuals. The gout attacks can be extremely painful, but they can be avoided by restricting foods that trigger the attack and keeping well hydrated. If a gout attack occurs, they can use medications to reduce pain, apply ice or a cortisone injection. It's also important to do some lifestyle modifications to prevent more gout attacks and joint destruction. If necessary, there are medications that the person can take to help them prevent future gout attacks. And if you like this video, press the thumbs up button here below and share this video with people that you know have gout. And don't forget to subscribe to this channel and watch my next video here. Goodbye!